Hey everyone, so it is a beautiful day here, and I've just come to take a little seat here. Pre-IV, this will be my 13th IV, and I'm feeling good in spirits today. I'm looking forward to having a nice nap. Feeling sleepy and very blessed. Just feeling very blessed today. And I wanted to share something with you. The other day I was down, and so I kind of learned when I'm down to just go to God and just talk to God and have that, just pray, basically, okay? And so I was just praying and praying. God revealed to me. He said, every time you see a cherry blossom tree, because cherry blossoms are my favorite, and right now they're just starting to bloom, so I'm getting so giddy every time I see one, like you don't even know. He said, every time you see a cherry blossom tree, I want you to smile. Just crack a smile. And so I smiled a lot on the way home that day, and it felt really good. And then sometimes God would bless me with like 5 cherry blossom trees lined up in front of each other or next to each other. And what would happen then is one little smile would turn into one giant smile. And before you knew it, I was actually laughing. It was like a forced laugh just like came out, but it was like joy from my soul, like just emerging. And it was a beautiful feeling. So I want to encourage you guys, when you're feeling down, maybe like you're out in public and you're feeling down, hurt, insecure, angry, or whatnot, find something, maybe something that God has blessed us with in nature. Find something and fixate on it, and every time you see that thing, smile, For me, it was cherry blossoms, and this whole way here, I've just been smiling. It's just gorgeous, and there's none around, or I would show you some, but I love cherry blossoms. So I'm going to get in for my IV treatment, feeling chipper, feeling tired. Hello, beautiful tree. Just sitting on this stump here. A little puppy came to greet me, and just blessed and enjoying, thanking God on the way over for the breath of life and a beautiful sky. I just picture the angels playing harps and violins and just singing and dancing and inviting all of us to just have that peace of Jesus within our hearts and souls and lives today. Hi, so I am in the IV room, and I have the IV in, and my doctor's here. We wanted to take a moment to tell you guys what has been done differently now to my dosage in lieu of the B vitamin complex that I was getting sick off of. Last time we fully admitted the B vitamin complex, and I did not feel ill after, so we are pretty sure that it was components in the B vitamin complex that were making me sick. So as you guys can see, if you can see that, it's pink again. And let me just flip this around so I can see what's being recorded. Okay, here's Dr. Horowitz. She's going to explain what's going on.
So we completely took out the B complex. The B complex contained thiamine, riboflavin, pyridoxine, dexapanthenol. I believe it was probably, and then niacinamide. It was probably the niacinamide that was causing the nauseousness, which is often the one that can be an issue for people. So what's in here is B12, which is hydroxycobalamin, also can be methylcobalamin or cyanocobalamin. I typically use hydroxycobalamin or methylcobalamin. In this particular one is hydroxycobalamin. I've also added B5, which is the pantothenic acid, which is also known as dexapanthenol, and then I've also added B6, which is pyridoxine, along with all of the other nutrients and amino acids that are in this bag. So It seems that last time we did this, it was fine. Johnny didn't respond at all with any nauseousness or sick feeling, so we're going with the assumption that it was the niacinamide in the B complex that was causing the problem. Okay.
So basically, for people that may not understand, we didn't add the B complex, but we did add 3 individual B vitamins to my previous existing dosage. So, and I just actually have a question.
Mm-hmm.
While you were saying that, so there's different types of B12 to add.
Correct.
What made you choose to use the one that you did for my bag?
I don't ever use the cyanocobalamin because it does have a small amount of cyanide in it. I usually use hydroxycobalamin or methylcobalamin. Methylcobalamin is known to cross the blood-brain barrier, so you feel it faster. And then hydroxycobalamin actually is longer lasting. Sorry.
I see.
I go between the methyl and the hydroxycobalamin for you, depending on kind of what's going on. And last time I did the methyl, so I was testing this one with the hydroxy.
Okay. When I get the B12 shots, is it the methyl?
It's a combination.
Oh, okay. Because those things can be very instant.
Yeah.
You know?
Yeah. So the methyl is fast acting, but we like to do both so that it lasts you longer.
Yeah, like a duration.
And
Great.
what I'll do is, now that I've separated them out, the next time I'll mix them.
Okay, great. Great. Thank you so much.
Sounds good.